joining us, and I will turn it over to you.
Thank you so much, Anne, for that introduction. This is Erin Ficker, as Anne said, from the Great Lakes PTTC, and I serve as one of the prevention managers, so I'm excited to be here. For those of you who are with us last week, for the first part of this, thank you so much. And if you could you use the hand raise function and just raise your hand to let us know if you were with us last week and came back for some more good old-fashioned data-driven decision-making. Great. And you can just use that hand raise feature up there in the top left-hand corner. Great. Well, it looks like several of you were, and for those of you who were not, that's absolutely fine. We will just continue to move through. And we will catch you up where needed. So if you have any questions or something doesn't make sense, please feel free to just type anything in the chat as we go along. And last week, we did our poll and asked you the question, how do you feel about data? And last week, most of our responses were, in the middle, mostly confident, okay, I guess. So we've already seen an increase in our comfortability, which is now a word, in our comfort level with using data in our work. So we've already seen some of the folks who've answered. If you haven't had a chance to answer that poll, feel free right now to just, right now in real time, we're broadcasting the results live, so just take a quick second to, sorry, I have a slide mix-up. So take a second to vote if you haven't already. Thank you so much. But yeah, it looks like people are invigorated and confident, which is great, which means we've made some progress even since last week. Great. So I'm going to just get my slides in order here in 1 second. Wonderful. Okay, great. So as last week, we talked about our objectives were to apply essential elements of the fifth of planning, including development of data-driven decision-making plans. We were looking to identify, interpret, and analyze local data. We were talking about using local data to inform planning and prioritization of risk factors, search for strategies that address priority risk and protective factors, and develop an understanding of how logic models help to guide implementation. So as you can see, there we go. These are the three that we're really going to focus on today. The other two we did focus on last week. So we're really going to be talking about using the data to make the decisions. We spent a lot of time about identifying, interpreting, and analyzing and looking at data and gathering it last week. And this week we're really going to focus on what are we going to do with that? How are we going to use it to make decisions? It's really the heart of our conversation. So you really didn't miss much if you weren't here last week. I mean, you missed some great, wonderful information, but I think we'll be able to pick right up together. So our agenda last week, like I said, we talked about defining data-driven decision-making, where do we find the data, how do we assess it, and how do we interpret it, and then this week, this session, we're going to talk about understanding logic models, using data to identify strategies for prevention work, determining best fit, and again, that's using data to determine the best fit for our programs, and then talking about fidelity and adaptation of those programs. So we're really moving into how are we then using this data to make these decisions. And I'm really excited to have Kyle back with us this week. He is such a great resource and shared so much with us. So thank you, Kyle, for being here again. And last week, Kyle and I challenged you to do some homework. And it turns out we're all in summer mode because I didn't hear back from anyone about any homework, but I will ask Kyle. I know, Kyle, you did some homework, and if you want to ask our participants if they did any. So I'm going to turn it over to Kyle right now.
Well, thank you very much, Ann and Erin. I also am hitting that technical issue with, sounds like an echo in the background. Hopefully it is sounding okay, but I'll let my technical team tell me if it is. If not, we'll work on something. But I did homework last week, and one of the things that occurred is based on our discussions is we wanted some additional places to find crime data, particularly for rural communities, and also for communities that are cities that may not have accurate reporting back to you for your coalitions and prevention. So one of the places that I went that I think you will find to be effective is the FBI maintains a list of data and also crime statistics for cities, including rural communities and sheriff's departments. And one of the crime sources of data that you can get is Crime Data Explorer. So if you haven't got a chance to Google that, that is definitely a place to go and get some crime data. For example, I looked up, I know some of you were from Wisconsin, so I looked up Wisconsin stats today. I went in and looked at the Madison Police Department. The Federal Bureau of Investigations has data out there broken out by violent and property crime and then subsets of each. And one of the things that you notice when you go into those websites is you can pull up any police department, rural or urban, cities or sheriff's departments, and it will give you that data the way that you would like to see it related to crime. It does not specifically mention juvenile crime. If we're looking for juvenile crime, we would go to the individual county departments of probation or juvenile services. And in most cases, states do report that data at the county level. But if they don't, you can always go to those departments, and most of them have a report that they can release. So to go through it, homework was one of the things that I did. Fortunately, we did not get a lot of homework requests this week, but if that does help, let me know. Again, that resource that I use quite a bit is the Crime Data Explorer. I will tell you the website is not user-friendly for Internet Explorer, so you may want to use Google Chrome or something along that to get to the data a little quicker. So that takes us to the homework piece, and wanted to make sure you got a chance to have that additional piece of data. When we start looking at where we're going today, one of the things that is important is that we start taking what we did last week and we bring it forward. And what we did last week is we started looking at the way that we do data-driven decision-making. I hope that you got out of that is that our field is moving quickly toward using data to make better decisions, much better than we did with the trefening tool that we showed last week, where to treat substance abuse and mental health, we were actually cutting holes in people's skulls. But I would tell you at this point in time, we are still in its infancy related to data and how best to use it, particularly when we compare that, for example, to the medical field. Now, don't feel too bad about our progress thus far. If you have to remember, the medical field, even almost 100 years ago today, still did not fully understand the need to have a sterile and clinical surgical environment, and we were still using tools and equipment that wasn't fully cleaned, resulting in a lot of infection. So as you go through that process, they were learning just like we are, so we're not too far behind. What we're going to look at today then is linking data with best fit. And best fit, as we go through here, is what really works for you and for your community. So one of the things that occurs in this process is we want to know how we take the data we collected last week, data we analyze, and we move it into a best fit practice. The way that we do that is through a process called a logic model. Now, we should all be familiar with logic models. Logic models are something that is in our field and has been in our field for several decades now. I personally use logic models for just about everything I do, including when my family and I went on an RV trip for a couple of summers with an RV we had. Every trip had a logic model. What the outcome was is what you always begin with, what did I want to achieve, and we build it backwards. Anytime my kids have a project, the first thing I ask them to do, if they want my assistance, is to create a logic model, whether it's a project, whether it's a fundraising campaign, or going on, like my middle child did, going to Arizona trip, logic model that bad boy out. And so as you go through this process, logic models are a key tool that we use in our field, and one that I cannot overstate the importance of if you do it effectively and do it correctly. So one of the things that we want to look at when we deal with what is a logic model is that it is broken down basically into three primary parts. That first part is problems and related behavior. That's going to link us to risk and protective factor changes. And then from once I know my risk and protective factors, I can look at effective interventions. So as we go through that process, we're going to start looking at how we use our data to create these logic models. Now, you should already know this, so this should be a quick review. But obviously, a logic model helps monitor progress. It serves as an evaluation framework. It makes assumptions explicit, which I find most important. If you are a community coalition and you work with community partners, you want to have a robust and well-defined logic model. One of the things you're going to have is people coming back to you saying, the data you collected and analyzed was not accurate. And one of my examples that I worked with, I was a part of a community coalition that was trying to reduce juvenile delinquency rates, including substance abuse. One of the subcategories there were the number of kids being expelled from school. We also looked at recidivism rate. We got some funding to put probation officers inside the school to work with kids during the school day. And in the first year, we found out recidivism rates increased. We had defined recidivism rate using the state definition. Everybody signed off on the logic model, so the assumption was explicit. And when the chief of probation didn't like the data and she came to complain about that, we were able to go back and say, these are all the definitions and analysis we used. Was there an error? If the answer was no, because at that point it wasn't, then we had to change the logic model going forward to reflect the definition she wanted to use, and we got everybody to buy in on the new definition. But as you go through the process, making those assumptions explicit saves you time, energy, and effort in the long run, so it may take a little upfront planning. It also helps us refrain from overpromising. It promotes communication. And the one benefit that's not on this form or the sheet, the one that I always tell everybody as well, is that it reduces mission creep. If you are someone who's dealing with a coalition and gets funding, I guarantee you, you or your staff have been hit with this idea of mission creep. And mission creep is, well, you're here on my campus. Instead of doing this today and working toward that project, can you help me with Y? Y can be, can you go out and supervise kids coming off the bus? Can you go and talk to parents in this conference? Can you go in here and supervise this classroom because the teacher couldn't make it in just yet? That becomes part of helping out the community, but it's also taking you away from what your objective is, and that's mission creep. So one of the things that you want to have is a logic model that talks about what your roles are, and we even put in a logic model stream about unanticipated consequences related to mission creep, and we track the percentage of time that was not allocated to a specific task at hand. So benefits of logic models are strong, and if you haven't got them for your program, you definitely want to make sure you go back and revisit how to create those. When we get into logic in terms of data sources for a logic model, obviously, first and foremost is your community needs assessment that you probably already have and are update. If not, as we talked about last week, go find people who write grants in your community, find people who've been funded for federal sources or state local sources. They'll usually have really good data. Make a library of data for yourself so you have that data. Where you can't find local data, supplement it with state data. And as needed, but sparingly use national data. We just talked about today for crime data. There's obviously the Crime Data Explorer that will drill down to individual police departments. I will say I don't think we have anybody on from Mississippi. That's the only state that does not participate in the upload process for the Crime Data Explorer. So we have our data now. We talked about that last week, and we're starting to move it forward. And we want to know now, if I have my data, I verify my data, I start to identify specifically what my problems are and what the behaviors are in our community. So as you go through it, I have the data, and I'm able to identify specifically those data sources. And I'm able to say, hey, in my community, I am having issues with increased juvenile use of e-cigarettes, increased number of people reporting overdoses related to opioids. I have an increase number of underage users who are consuming alcohol. Those may be the problems that I see initially. Data might also inform me that I have an increasing crime rate, particularly around property crime that could be related to substance abuse concerns. I might have academic achievement concerns related to the schools. I might have school climate concerns that are more interested in using substances or feeling less safe on campuses for various reasons, so they're not attending. I might have parental concerns where I might not have enough resources to teach parents and teach skills to parents about what to do with cigarettes, what a Juul looks like, how you can identify it from a flash drive. When my daughter brought home a full packet, it took me about 15 minutes to figure out exactly what it was. And it's amazing how tricky they have been and able to hide that and make it look like it's just part of a regular piece of equipment you would have for your computer. So one of the things that we start looking at is once I identify my problems related to behavior like we did last week, we want to start thinking about risk and protective factors. Now, as a quick review, one of the things that we want to deal with when we start talking about risk and protective factors is we want to make sure that we know the difference between the two of these. Anything you do in relation to your coalition should be specific to, once you have your CNA, your community needs assessment done, related to either reducing risk or improving protective factors. If you live in a community where you're only reducing risk, you're generally not going to be as effective as a community that addresses both. Sounds like we may be having some technical issues. Let me adjust this real quick. If we are okay, I will continue. Could be that I just hit my microphone and got away from my face. So, but one of the things that's important to note is now we have risk factor data. And one of the things that is, well, I tell you what, I'm still breaking up. Erin, what I'll do is I'll have to take over and I'll call in on a different line.
Okay, great. Thank you so much, Kyle. Yeah, so I'll just take this minute while Kyle is switching over his phone line. Thank you so much for doing that. We want to make sure everyone can hear well. It's just to ask folks, and I'm actually going to go back in the slides, ask folks how many of you all, so Kyle's talking a little bit about risk factor data here and the characteristics that are associated with a higher likelihood of problem outcomes. So those are biological, psychological, family, community, and cultural that precede and is associated with a higher risk of problems. So I'm curious, and I'm going to go back actually and ask how many of y'all have done a logic model in the past? And you can either type in the chat box or you can raise your hand. And for those of you who have used a logic model, where have you found data for risk factors? So for those of you who have done, yes, we have several people already who are saying, yep, they've definitely done a logic model in the past. Where have you identified that risk factor data, which can be very important in setting the stage for where we're going to go with our interventions and how we're going to learn more and be most effective. So I'm watching some people type. And risk factor data can also be paired with protective factor data, which is largely kind of the inverse of risk factor, meaning it's characteristics that are associated with lower likelihood of problem outcomes. So, oh, great. Look, it looks like Clay says they utilize the Indiana Youth Survey to identify risk and protective factors by state, county, and region. That's wonderful that you can get down to that. And youth survey data is a great place to get at some of those risk factors. They're usually very good at asking risk factor questions. Oklahoma Prevention Youth Assessment is a statewide survey. Great, and that survey helps people look at school districts. And it says it looks like most states often have these kind of surveys that can be assessed through the Department of Mental Health. Great. So prevention needs assessment data in Oklahoma, and it's able to be broken down to the county level. That's fantastic. So Carla, I was just asking folks while you were gone kind of where they have gone, if they've used a logic model in the past, and how they have collected or where they've been able to find risk factor data. So we're just seeing some of those answers come in now. Let's see if your line's any better.
All right, let's see how we do. So what do you think, Erin? Better?
So far, so good. Let's keep going. I'm sure people want to hear from you.
Well, I do appreciate you stepping in, and I apologize for that technical issue. Again, you take a text in and put them near a computer, and all sorts of things are bound to go bad, and so no exception here. It is great to see the number of people who use different data sources, and so a lot of that is that youth prevention data source, and if your state does that, particularly at your county level, or even more impressive if your district does, what a great resource that you have. And one of the things that I will tell you, though, is whenever you deal with these data sources that we talked about last week, just remember you want to make sure that you verify those data sources. Dealing with that in terms of risk factors, one of the things that occurs, you get those data sources, you assume them to be accurate, and we know what happens when we get ahead of ourselves with assumptions and we start assuming. One of the things that occurred in that process is I was working with a state. The state was moving toward creating a statewide social host policy. I was working with several local communities that had already implemented one. And when I got the state level data, as I always do, I don't want just the percentages they report, I want the raw data set. And when I was going through the raw data set, I found where the state for the last 6 years had been using an incorrect calculation, which was the underreporting of substance use. So one of the things that occurs in that process is always verify your data, and when you can, make sure you get the numerator and the denominator, i.e. the raw data set whenever possible. But those are great places to go for risk factor data. And remember, one of the things that you're looking for with your logic model is to make sure that that risk factor is backed up with data. Erin, I really appreciate you picking up for me, and assuming I don't have any more technology issues, hopefully you won't have to step in and bat for me again.
Okay, happy to do it.
So as we go through here, one of the things that occurs is that we have our risk factor, we break it down at different levels, and we're going to talk a little bit about that in a minute, that we want to know not only what the risk factor is, but where is it specifically being the most difficult problem. So one of the things that we noticed even this week, if you are in a community coalition and you're on this line, you probably are not a grant writer because there are quite a number of grants going in to the U.S. Department of Education on Monday related to school climate, and part of school climate is mental health concerns and substance abuse issues around physical and mental health. So a lot of people are writing those grants this week. It is neat and great to hear people talking about the data they collect and analyze, and several people came to me this last week and were saying, Kyle, in this data we're writing for this grant, overall substance use was actually going down. And I said, that's great. That's a great reason and a great thing to report in your community that they're making strides with this process. But when you look at aggregated numbers for your risk factors, you sometimes will not be able to analyze and see what the trends really are. And what had happened in this one community this week is the data they received was overweighted for 5th graders. And we know that unfortunately 5th graders still use and do use substances, but not at the rates typically of the 7th, 9th, and 11th graders that they were surveying. And because there was such a heavy overweight in the younger group, the overall percentage was down. But when you broke out 7th through 9th graders, the rate had increased 20% higher than the state average. So their data showed that the community was making great progress at reducing overall substance use, but particularly in earlier grades where they had some specific programs. But when they got to middle school, they lost those programs. So here they were able to use their student level data to be able to say the district's doing great for younger kids, but we now need to spend some additional time, energy, and effort to focus specifically on this subpopulation. And that's where risk factor data can be most helpful, using it to identify what the trends are, what the risks are, and if there is a certain subgroup in the population that has a higher need than others. And because of that, I think their proposal is going to be much stronger, but more importantly, their community is now informed. And that's a way of making data-informed decisions. So as we go through the process, we should have some risk factor data. Here's an example. This is a true example of risk factor data that came out of a grant application that I helped write about a year ago. And so as you go through this process, it is evident that there is a concern in this local community related to teen pregnancy. the teen pregnancy, and I took out the name of the school district that was looking at this data just for confidentiality reasons, because I didn't get permission from the superintendent to broadcast it nationwide, as I think we have people even from this conference call, or at least last week, all the way from Alaska. So I wanted to make sure I kept it somewhat anonymous as much as I could. So as you go through this process, then we have the 2017 data. We look at the rate and that it is higher than the state average. So we're saying, okay, how do we compare? And it does not compare in terms of our risk factor favorably. So one of the things that occurs in that process, you will also notice that the data doesn't just go by rate. It also tells you what it was. It was 89 per 1,000 compared to the state rate of 30.3 per 1,000. So as you move through here, here's what risk factor data can look like. Here are some sources of that data. Most Census Bureau data will keep census-level data. If you haven't gotten that yet, you can even go down to, on the census, to a school district. And if you, depending on how often they've been updating the census, but usually they do it about every year, there's estimates. And one of their estimates is on fertility. And one of the fertility rates you can look at is teens. And they have a 15 to 19 piece in there. So that's one part of the risk factors that you can assess. So again, an example of what risk factor data looks like and what it looks like when you present that data. And again, I want to make sure that you caution that you always put in the actual rate that you're referencing so other people can get the same calculation that you do. So here's an example of that risk factor data. But as we know, one of the things that's important to understand is that your community isn't just comprised of risks. Now, one of the things that occurs in any community, every community has problems. Every community has issues. Even our most iconic TV shows in American history have communities with issues in it. Mayberry is one of those examples that people sometimes nostalgically go back to that talk about a rural county, that was a rural city that was doing really well. But if you remember that show, they had a police-involved shooting. They had police officers who could only carry one bullet because of the lack of training and impulsivity of the officer. There was a drunk tank that had a standing open door policy. So there were issues even in the most iconic and idyllic settings and some of our greatest, our most historically great by percentage-wise TV shows. So as you go through the process, then we also need to look at the reverse of that. And one of the things, I think we've already gotten this one, and so the risk factor piece is to look at a protective factor. And so the protective factor is a characteristic at the individual or family level that is associated with a lower likelihood of problem outcomes. So one of the things that we look at in a protective factor, for example, around substance abuse or school involvement and those kind of things, are the number of kids who are actively participating in school activities. We know there is a correlation between strong school involvement, particularly among our youth, or community involvement in our youth, and substance abuse rates. In fact, as the number of kids are participating in youthful activities, there usually is a corresponding decrease in the number of kids reporting substance use. So that's an example of a protective factor, and your community should have multiple protective factors already in it. So as you go through the process, it is one of the things that you need to do in your community needs assessment is also address what's going right in your community. Some cases, a risk factor may highlight a protective factor, and we just talked about that with the substance abuse rates going down overall because they had programs in the earlier grades. So one of the protective factors here at the community level is the community had invested in a substance abuse prevention program in the elementary school grades that allowed them to show a decrease in the number of kids using. But that same program or an effective program was not implemented in the older grades in what they call secondary because it was 7th and higher. And in that secondary grade levels, they took out those curriculums and programs, and they saw a corresponding increase over the state average. So as you go through the process, sometimes this data can go both ways and highlight a risk factor might highlight a protective factor, and as you explore protective factors, you may stumble across risk factors. So definitely protective factors is one you want to take a look at, and as you go through these pieces, you want to make sure that you have a balance of risk and protective factors in your community needs assessment and when you're addressing the community. These can also include such things as mental health referrals and mental health improvements in your community. Increases in the number of mental health resources that are available are all protective factors. The easier access to mental health treatment and mental health resources around prevention, usually the less number of students you're going to have reporting those issues. So protective factors become an important piece in relationship to what we want to have happen in our community, and it's one that we sometimes overlook, particularly if you are focused on funding, like some of us might be. If you are totally focused on funding, some cases you only think you have to report risk factors. That does help with grant applications, but some cases the best thing for a grant application to do if you're in that world is to sit back and say, hey, when I got federal funding before, we showed a decrease. We had improved we improved our protective factors in our communities, which allowed us to see a reduction in the likelihood of our problem outcomes. And here's an example. But because we don't have funding to expand X, Y, and Z, this is the outcomes that we're seeing in those grade levels or in these age populations, and we need to have a different approach. So that's a way that we can use protective factors in our organization. Here's another example of a protective factor. We know that kids who feel connected to their schools are less likely to be disruptive in school, also are less likely to have bullying in school, and also have reductions in the number of kids reporting mental health issues, particularly anxiety and depression. For those of you who have kids, particularly early teens, preteens, and on up, it is absolutely astonishing the number and rapid increase in mental health concerns in that population, particularly related to social media's influences on kids' perception of themselves. And we're seeing a huge increase in the number of kids reporting hopelessness, chronic hopelessness and helplessness, and our teen suicide rates, as everybody knows, is increasing to the point it's staggering and almost epidemic in my opinion. And again, this is not anybody's opinion. I'm just a consultant being hired. So if you don't like what I had to say there, just know that that's completely on me, in my opinion. But as you go through it, I think you're going to hear more and more about those concerns. But here's an example of protective factor data, again using a school environmental survey, that had a 74% increase in the number of students who reported connectedness to their school. And this represents a 6.9 increase over the 2007 data. And again, we reference the data source here. So as you go through the process, good protective data are going to be data that is recently evaluated or assessed, that is somewhat got a trend to it. And just like with any data source, and we talked a little bit about last week, you want your data to be a movie, not a snapshot. And so one of the things that occurs is a lot of cases, if somebody comes in and says, hey, it's 2019, but in 2016 our kids thought this. Now, that's okay, but that is in terms of a school system, that is a huge amount of time ago. 2016 kids and their issues and their concerns versus 2019, that has significantly changed. 2016 Snapchat was just beginning. Now you have things such as TikTok that were never even heard of back in 2016. So technology is changing rapidly. Our kids' lives are evolving to match that technology, and our data has to do the same. So definitely make sure that you have as most updated data as possible. And if you don't have it, those are going to be those sources and questions that you have with your community members. So here are some examples of a protective factor. And those protective factors then are things that allow us to have success in our community by reducing the number of problems or the potential for problem outcomes. Just like we did with risk factors, what I'd like you to do is just take a second and where have you found some protective factor data? And so I'd just like you to type in real quick some examples of protective factor data that you have in your community that you found. You don't have to report specifically, but I definitely would like to know what data you use. For us, obviously the school is a good source of that. The other part of those pieces would be data related to crime and violence, which we get through our city police departments. But looking for where do you get your protective factors and where do you find your protective factor data? We have several people typing.
You know, this is Erin. So, Kyle, I've found in my experience that protective factors is often something that people use somewhat less than risk factor. That risk factor data is often pretty easy to grab onto. It's in a lot of surveys, and people are more inclined to make those direct connections. And sometimes it's harder to find and to use protective factor data and to kind of understand what it means. So it's something I've seen in the past.
And I absolutely agree with you. What I see is in our field, we are so trained to look at the negative outcomes and the things that aren't going right. Because remember, most of us on this call are community coalition people, and you exist to solve a problem. I never heard of a community coalition that existed because a problem didn't exist. And the history through public health and medical fields and so forth with community coalitions is to address a problem, get it fixed, and move on. And so they're focused just on those pieces. In some cases, it takes some time to move over and say, hey, we want to make sure that we are looking at both. And like Erin indicated, I think, is that the Oklahoma Prevention Needs Assessment has risk and protective factors. Excellent. So definitely make sure you pick up on that. Melissa indicated that the same sources that we get our risk factors from, which is the Search Institute for Protective Factors as well. Excellent. And she absolutely agrees with you, Erin, that protective factors are not used enough or overlooked. And I think a lot of cases, as we talked about, some people are concerned that if you talk about your protective factors, you're minimizing the reason why your organization is needed. And I find it the reverse. You want to show that your organization has made strides, but there are specific pockets that still need to be addressed. So as we go through excellent examples of protective factors that we use and that other people have used, so very, very good. Remember that when we're talking about protective factors, that it is linked to something that we already know exists in our community. And so as we go through the process, we have our risk behaviors, and then we move them forward and we start identifying the risk or protective factor data that we have or don't have in our community. So as we move through here, one of the things that's important to note is that we take all of this information and we apply it forward. Now, when we start looking at risk and protective factors, as we've already alluded to, it's important that we keep the context in mind, because one of the things that we have to do is know whether or not this risk or protective factor is related to the individual. Is it a family issue? Is it a community issue? And society issue or societal. So as you go through here, in what context am I addressing this problem in this data? So if I'm talking school level data, I'm usually talking either individual, talking about student reports of these concerns, and I might even have some family data, family participation in school. If I am looking at a survey of kids or parents or patients in a substance abuse program, then that might also be individual and family. If I look at services available in my area, that might be the community. And if I'm looking at overall low insurance rates or number of people in my community that are migrant and with no insurance, that might be more of a societal concern. So one of the things that you want to know is in what context this data comes from and how you plan to address it. Because clearly one of the things that we want to do is we want to take those risk and protective factors and we want to reduce the risk factors while enhancing the protective. But we need to know, are we doing that at the individual level, the family level, or the community level? As an example, you might have data that shows that you have the number of kids reporting increases in alcohol is going up, but the number, and so you have a number of underage use is increasing. You might have non-medical use of prescription drugs is increasing. And then you look over and you get your data and it shows one of the reasons that it's going up is you have a risk factor related to ease of access. So kids then are saying, hey, it's just really easy to get this stuff, and that's why we use these two substances. Well, if then at that point in time you need to know, well, do I want to address this at the individual level? Do I want to do individual counseling, individual prevention programs with them at the school level, family level? Or do I want to bring it to a family parenting program kind of piece? Do I want to try to get my community to address a ordinance that talks about social hosting for alcohol or a drug take-back program? Or is this more of a societal change to laws at the state or national level? What is my specific strategy? So this is where multiple context starts coming in. And at the same time we deal with multiple contexts, you have to start thinking about developmental perspective. And we started talking a little bit about this. I could have that risk data that says that the number of kids reporting, or protective factors that says the number of kids reporting substance use is decreasing. That would be an individual level piece because that's happening with these individual kids. But when I break it across a developmental perspective, I find that doesn't hold true for anywhere but early childhood. My middle childhood and adolescence is actually showing a slight increase, or in some cases, the young adulthood and adolescence is showing a 20% increase, which I would call significant. So as you go through here, it's important that we link our data, so our problem and risk that we identify with risk and protective factors, and then we identify whether we're going to address that multiple context of individual, family, community, or society, and then what the developmental perspective is going to be, particularly if it's at the individual or family level. So as we go through this process, we start having a lot more questions. And so one of the things is I now have my problem, I know my risk and protective factors, what do I do with it? Right? And that's really the challenge. What are we going to do to address this issue? Now, part of that assumption is that you have the resources, whether that's the people to do it, the institutional capacity to do it, meaning that you have the equipment and supplies to get it done. You have the intellectual capital, meaning not only do I have the people, but the people are trained. And then also, do I have the fortitude? Does my community, my bosses, my organization, the people that I'm going to work with, do they have the fortitude to want to make this change? And so as you go through that process, that takes us into the next step of the logic model piece. In that next step of the logic model is the intervention side. And so one of the things that occurs when we start dealing with the intervention, get my little arrow key up here, is now we need to start specifically using data to start being able to identify the strategies we want to use to impact the risk and protective factor. And so as we start looking at that intervention now, I want to say, okay, I know I have this problem or related behavior. I know it's related to this risk or protective factor. Now I need an intervention that's going to address that risk and protective factor at the individual early childhood level or at the family adolescent level. Now you can start looking across the scope of research about what these identified strategies are and where you can find them. Now, in no perfect world, you would be able to go to a database, because it is 2019, and you'd be able to type in, my problem is ease of access for high school students, and this is my population, and I'm looking at the individual, and I'm looking at the adolescent level, and I'm looking at a rural community. What do we got that makes the greatest impact on that risk factor? And you would expect somewhere along the line there would be a database that pops up that says, yep, here's the programs or list of programs that you want to use. Now, we have that in the medical field, right? So if you go to the doctor and you say, I got an ear infection, like I talked about last week, I can assure you the doctor already has a working list of medications and techniques that they're going to prescribe to reduce your ear infection or your child's ear infection. It is amazing at this point in time, despite multiple attempts and despite multiple efforts to do this, there is not a singular best source for all interventions that are known to be effective. So that puts the onus then on us to use our data to make informed decisions related to using and identifying strategies. So we're going to come back to interventions here in just a minute, but one of the things that we want to talk about then is, now that I know what I want to do, what do I do with it? And so this is using data to identify the specific strategies that we want to have. Now, one of the things that is important to note, and we talked about this last week, is we want to use an intervention that is specifically related to the problem at hand. And we want it to be something we know works. We don't want hearsay. I don't want assumption. I want to know that it has been used before and that it has been effective. I would not expect, nor would you, I think, tolerate going to a doctor with your child and the doctor says, well, I think it's this, I don't know, but let's go ahead and do this treatment anyway, or this surgery anyway. I think at that point in time you'd want a second opinion. And so as you go through this process, one of the things that we want to look for are what we call evidence-based strategies. Strategies that are interventions that we know are effective and that we have a history or at least some understanding of why it works, how it works, and more importantly, where it works. So as we go through that process, for the last decade or so, you've been hearing quite a bit about evidence-based interventions. And evidence-based interventions basically is trying to take us away from assumptions and hearsay. When I first started in the field in the late 80s and the early 90s, there was a lot of hearsay. Dr. So-and-so believes this, or Mrs. So-and-so or Dr. So-and-so believes that. And as you go through that process, one of the things that occurred is we were looking at some really crazy things. And one of my greatest examples of this was a $1 million a year project to reduce violence in particularly low-income housing projects in the Northeast. And I won't get you the particular state because you can look it up, and there are, definitely it's worth doing, but just know it's in the Northeast. And one of the things that occurred when that happened is they went out, and when they started putting out grant applications for this $1 million practice, somebody wrote in that they were going to reduce violence and personal injury, particularly domestic-related assaults and low-income housing by 25%. And they were funded. They got $1 million a year. And every new tenant that ever came to that housing complex received in the mail a box with a letter that says, this is from so-and-so organization, and this is a gift for you. Please wear it proudly. And it was a mood rock. And if you don't recall mood rocks, it was supposed to change the color corresponding to your mood. And one of the things that happened is they sold for about $20, and you wore them around, and it would change colors independently of your mood, but whether it was hot or humid or any of those kinds of things. Now, there were a few adherents out there who really believed that mood rocks were effective at identifying moods and trends, but what was never proven is that the mood rock at all was associated with reduction in violence. And so $1 million, and 5 years later, so a total of $5 million later, somebody decided to cancel the project, and the person who canceled it got sued by the organization that was sending out the mood rocks. So again, as you go through the process, just a little chuckle, I hope, for you, that talks about the fact that we've got to go a lot further and a lot farther along, because we could have used, I think, a lot better approach to addressing those issues than mood rocks. And oh, by the way, all the data that was collected during that time period showed no decline at all in anyone who was wearing a mood rock. So as you go through the process, evidence-based strategies and evidence-based interventions, it is incumbent upon the prevention field to optimize these resources because they're limited, and we need to make sure we know what works and why it works before we apply these lessons. So as you go through the process, we need to know what we're doing and not just guess, is what we're really saying. So the next part of that is just what is evidence, and we're not going to go into this much, but just know that evidence is if it's already been proven by somebody else. The What Works Clearinghouse is an example. If it's been published in a peer-reviewed journal article, meaning somebody else has looked at the data, looked at the analysis, and verified it. And then we also look at demonstrated effectiveness and formally documented in other ways. Particularly in tribal communities, they have elders and peer groups. They can actually be the ones who identify it as evidence. You can also do this is to create an evidence-based intervention selection group. We'll walk through it real quick. This is basically getting your stakeholders together. If you're a community coalition, you generally don't want one person prescribing what the intervention is going to be. You want this to be a shared approach, and so you want this selection group to be part of it, and that's one piece of it. So an evidence-based intervention selection group. The role of them is to understand, of course, what the SPF is and the priorities that you have and within the logic model. There's a document out there that you can get called Identifying and Selecting Evidence-Based Interventions, and then review your comprehensive plans and make those recommendations. So as you go through the process, there's kind of a strategy that you can use to take this data, put it before a group, and let them come up using some of these tools to identify specifically what you think they would think or would be best for their community. Again, you should already have the needs data taken care of. You should already know what your risk and protective factors are. And then you're coming to this group to say, here is my idea of some interventions. What do you think? And so as you go through this process, we're looking at impacts to that protective and risk factors. And an EBI is one way to get around it if you're concerned about making an independent decision. So as you go through that process, this is that example. Additional responsibilities of the EBI is locating appropriate interventions, making recommendations, and then creating a plan to ensure the implementation with fidelity. The subtle, nondescript piece here is somebody in a group of people who represents your community is making this decision as a whole. So it's not just one individual. And so what you're bringing in is a diversity of opinions on what the best intervention would be, a diversity of opinion who hopefully represent your community and all members of your community, so that when you're out there and you're trying to implement your intervention, you have the backing of your entire community that says, yes, this is the plan and approach we want to use. If you don't have it, things fall apart. So as one goes through that process, just keep that in mind, that you use your EBI group as kind of a sounding board for your community to see what works. There are true courses where we know certain things will not work. In Texas, where I'm from, one of the things that we know is we have a law that allows parents to give their children beer in a bar, no matter what age that child is. So a child comes in at 6, I can buy my 6-year-old a beer and give it to him or her, and then they can drink it as long as I am there present, paying for it and watching the child consume it. It's illegal for me to go to the bathroom while they're drinking it, but as long as they're there, Texas allows that. So coming into Texas saying we're going to have a program that prevents that runs into a lot of opposition, and a lot of communities, though we know it would be best practice, don't want to take on alienation of a large segment of the population. So this is what an EBI group would do. They would sit back and say, look, this may be a great effective approach, but it's not going to work here. So as you go through that process, that's that sounding board. And that sounding board, as we get into it, is something called a fit. Is what we're proposing a fit? And that's what the EBI is designed to do. And so one of the things that occurs then is we start looking at strategic fit. And strategic fit simply, our strategies should be both evidence-based and a strong fit for the community's objectives. And there's a whole process related to identifying it. And a lot of people get weary-eyed and disgruntled when they see this chart. And they look at this chart because it's been in a lot of publications, and they sit back and they start scratching their head. And when I see this chart, what I see is Yelp. And if you aren't familiar with Yelp, Yelp is an app that you can get on your phone or on your computer that tells you what the best places in town are. So, for example, the other day, on Saturday, my wife wanted deep dish pizza. Now, she's from Champaign, Illinois, and I know some people are from Illinois on this conference call. She is now in Texas. And getting a deep dish pan pizza in Texas is nearly impossible. So much so that it is nearly impossible that in some cases I've been flying pizza in using dry ice, which still is better than nothing, but still not the same as getting it fresh out of the oven. But this is what Yelp does. So the other day she wanted pizza. So I went to Yelp, and it gave me a listing of all the restaurants in town, and the biggest one by far was a 4-star, and it was related to barbecue. Well, was it relevant, which is the first question this strategy asks? No, I want pizza. So you have to make sure that what you find out there is relevant to the situation. I wanted deep dish pizza. Yelp was giving me first indication was barbecue. That's not relevant. So I need to refine my strategy, and now I found pizzas. The next one was practical. And when I went out and looked at Yelp, they said the best pizza place for deep dish pizza was in Chicago. Well, thank you very much, Yelp. I understand that, but I'm in Texas, so it's not practical for me to go to Chicago Saturday just to get the pizza, nor was it practical really for me to build a pizza spot. So I had to make sure then that it was practical for the community I was in, and the answer there was no. But we did find one, and eventually we were able to identify one just outside of College Station that had a deep dish pizza, and so we went to the next piece, and that is evidence of effectiveness. Now, what is the evidence of effectiveness for a deep dish Chicago-style pizza? Yelp review. Was it good? Now, clearly the best one would be is for me to go out there, buy it, test it myself, but I wanted to make sure I did my due diligence before we made that trip. And sure enough, the reviews came back in almost all positive, so we decided to give it a try. So as you go through the process, don't get overwhelmed by what the strategies and best fits are. Just know, is it relevant? Is it hamburgers to my deep dish pizza? So let's make sure we're comparing apples to apples or pizza to pizza. Is it practical? Is it local? Is it something we can get done now here in our community as it is, or do I have to go somewhere else for it? And what does it mean in terms of effectiveness? Is it good? And in this case, the pizza was very, very good. So as you go through the process, this is the piece of the best fit strategy that you or your group will need to walk through to make sure whatever intervention you select is relevant, practical, and effective. So here's an example of 2 programs related to the increase in teen pregnancy we had a couple of slides ago. Which one would be best fit? So as you go through that process, what I would like you to do is to sit back in the title bar down below, type in which one do you think is the best fit. Should we use Incredible Years in our community or teen pregnancy prevention? Both of these are evidence-based. So what do you think is best fit for a community that is addressing teen pregnancy issues? Got a couple of people typing. Always like it when it says multiples. We got a vote for teen pregnancy, TPP. Somebody already knows it. Very good. Excellent. So as you go through the process, that's right. Now, clearly, Incredible Years is a great program, but it's designed for parents after they have kids, not for prevention of the pregnancy to begin with. So just on the fact of whether or not we have, is it relevant, the answer there is the only one that's truly relevant is teen pregnancy prevention. So as you go through the process, that's just a quick way to go through that list of being able to say, okay, let's take a look at these. What can we start moving in and out of in terms of all these possible interventions that are going to address our risk or protective factor that addresses the need we have in our community? Excellent. I appreciate everybody who participated in that. But yes, teen pregnancy prevention would be the one that is clearly the best fit for our community in this scenario. Now, Incredible Years would be a great one if we're dealing with kids who are in school or kids and parents and trying to increase parenting skills, but definitely not one for teen pregnancy straight up. So as we go through that process then, now we have gone through the process of risk and addressing risk and protective factors based on the needs in our community. We've identified the risk and protective factors that we want to address, and now we started to narrow down not only the context in the domain that we're going to address it in, but we also have started to identify our specific interventions. So now we know, hey, well, let's take a look at maybe TPP, or we're going to use CAST or Reconnecting Youth or Signs of Suicide or Youth Mental Health First Aid based on whatever is happening in our community that we need to address. To get to the next point, we need to use the same level of data to drive our logic model, and that is to start creating those objectives. And as we go through these processes, one of the things that is important is we are evaluated more on our objectives than we are our goals. Goals are really high level. They're meant to be almost unachievable. They're supposed to be the goal of zero substance use in our community for kids under the age of 21, or zero underage alcohol use, or zero non-medical use of prescription drugs. That's a goal. The objective, though, is going to be much more refined and much more specific to the intervention, but also to our risk and protective factor that we're trying to address. And quickly, what we want to make sure that everybody is clear of is that we need to make sure that these are smart, and that we are smart about the objectives we use and the way that we put our objectives together. Objectives should be specific, they should be measurable, and they provide guidelines on how a goal can be accomplished. So as you go through that process, one of the things that's always important in the objective is that it's very, very specific, and that we have ways of being able to measure it, and that it's related to the goal, and more importantly, that goal then is a subset that's going to be the risk or protective factor. Smart objectives then are that specific, they're measurable, they're attainable, they're relevant, and they're time-bound. So one of the things that's always impressive when you start reading objectives and you start hearing about other people's objectives is some cases objectives and goals get confused, and they're going to say we want 0% increase in youth underage, in reports of youth underage minors in possessions. All right. Well, not too specific, kind of measurable, not sure what you're going to do to obtain it, right? And it gives me no time bound, over 1 year, 6 months, 2 years, 5 years, 10 years. So as you go through the process, we need to start looking then at identifying what are some of the objectives that we have and what constitutes those objectives. So one of the things that we want to make sure is that these objectives are related to the goal, but that these objectives then are also related to an outcome, and that outcome is something we want to achieve. So a specific objective, I want a 10% decrease as measured by, within, after using this program. So as you go through the process, you want to start putting those pieces from the intervention that link back to your risk or protective factor that identify the problem. So the problem in our community is that we have an increasing number of teen pregnancies. That is what we identified. One of the risk factors is that there are no after-school or other programmings for teens to participate in. Thus, they're using more alcohol, and they're making poor choices when it comes to interactions with each other. So one of the things that we're looking at then is the consequences is we're starting to see an increase in teen pregnancy rates. So we want to implement teen pregnancy prevention. So students after going through teen pregnancy prevention will see a 10% decrease in the number of teen pregnancies in the next year. That gets you a much better idea of what you're attempting to accomplish and how it can be identified than if it's just simply saying we're going to reduce teen pregnancy. A good way to do that is looking at objectives is to try to decide which one of these you would fund. So as you go through this next slide, we're going to start looking at quizzes, and this one little quiz is it logical? And we have 3 pieces here. So take a look at this first objective. By December of 2019, 100 students will have an increase in knowledge on how to refuse alcohol from peers. So this is a specific objective related to that. Another one is compared to 2014-15 baseline data. The percentage of minors drinking during a community-sponsored event will decrease by 20%. And a third example is after implementing a drug take-back program in the spring of 2019, junior and high school students will report a 10% decrease in the ease of obtaining OxyContin, question 21, as measured by comparing the results from the May 2020 school climate survey with the results of the 2018 school climate survey. So what I'd like you to do here is first and foremost at the top, take a poll. Which one do you think sounds better? And then down below, why? So as you can tell, we have 3 boxes down below. On the left is the first objective. So if you think it's the best one, tell me why or what you like about it. The middle one, tell me what you like about it if you selected it. And then finally, the third one. Which one do you think is the best? And then give me a why. And we'll have to give a prize to Megan right now because she's the only one that looks like is answering. And one of the things that we note within the different types of objectives is each one has their something that's good about them, but not every single one of them is a full objective.
Kyle, it looks like we're getting a lot of votes for that third after implementing the drug take-back program one. And we've got one for the top one by December. And go ahead, type in those boxes why you chose the one you did, or if you even want to identify what you see as good or the drawback in the others. So I'm going to let you guys type for a minute. Thanks so much. Yeah, folks typing. So Casey says number 3 is a SMART goal, and that it's more complete response. It's really long. I can't see that on a T-shirt. No, that's quite a T-shirt. Joanne says of the first one, it's not clear how it would be measured. So how would you measure that? It's information that's missing. It has time. That will also of the first one, the objective has a time frame and a number of students. The number of students impacted and how it will increase definitely has a lot going for it. Erin says it has time, what the change will be, but no measure. So that seems to be what people are identifying as missing from number 1, is that there's not a measure. So for I see we have someone typing for number 2. For number 3, I continue to see folks saying that this is timely, specific, measurable, using previous data to identify the problem as a reference for any change that could occur based on the program. This can show if the program is effective. Yep, there's definitely a lot going on in number 3 with regards to the data. Number 2, I'm seeing folks saying that the data is being compared, to is outdated. So that's an interesting point. Erin also points out that there's no specific time frame, just comparison of baseline data. So it has some of the things maybe that number 1 is missing, but missing some of the things that number 1 has. Looks like we got a lot of folks who really think it's number 3 with measurable, that's measurable and has clear data.
Yeah, it is definitely looking good, and we have overwhelming percentage of people for number 3. So as we go through that process, and I definitely agree with everybody's comments. Number 1, the benefit of number 1 clearly, as already pointed out by several people, is that it's got a time frame, and that is by December blah. So as you go through that process, by December of 2019, we have the number of students, and we know what they're going to achieve, which is an increase in. But what we don't have is that measurable piece. And we also don't really have an idea of what's supposed to change between them, what's going to happen to cause this change. So it is decent, but it is clearly not the smartest objective. In terms of on number 2, which is compared to 2014-15, clearly that data is old and older. If you think about it, that would be kids who are already in almost out of college, I guess, if they were seniors. And if they were freshmen when they took this, they would no longer be in high school. So that tells you kind of the cycle of how quickly school time would change. So everybody's got great points. Everybody has hit the nail on the head in regards to why each of those are good and where the weaknesses are. Clearly, number 3 could be improved if we had a specific report deadline, like by this date, we will take this completion and do this analysis. But excellent. I appreciate everybody looking into this and taking a look at it. I always look at it, the bottom line for me is which one would I fund? If I was a funder and I am looking at trying to fund a particular objective, which one gives me the most assurance or at least the most faith that I will actually have a measure that can be defended? And so as you go through that process, in those opinions, we're looking at those, and I guess it's 91.6% say that would be number 3. So very good. I appreciate that participation. Erin, thank you very much as well.
Yeah, thanks, Gail. That was really helpful.
So as we go through here, then one of the things that's important to note is that we need to know if something sounds logical and is it smart. And again, that is specific, measurable, obtainable, relevant, and time-bound by when. So it is vital that as we go through this process that we use this kind of approach in our logic model so that when people say, hey, what did you do? We have some very concrete evidences and using our data to support the decisions that we made. Now, it's also important to note that not every decision you make will show to be effective, and this is important to know. A lot of people believe that there is bad data, and my belief is there's no such thing as bad data. Data that informs us of what not to do is just as important as data that informs us of what to do. So as you go through the process, we all want that data. I think it comes from our years in school. We want the right answer. Hey, we said we were going to reduce it, and we did. That's great. But a lot of cases, the most important information we have is this. It didn't work, and here's why. If you know why something didn't work, that is vital information to share with the rest of the world about why it didn't work. But it also informs you so you can make better informed decisions the next time around. Was it because it was outdated? It didn't work in the population you thought it would? It wasn't conforming to rural, and that's where you were, and it was designed for urban where there's supposed to be large numbers of mass transportation, and you don't have that in your community? What made it not work? Once you understand the data and you start collecting that data, you may be tempted then to want to change the intervention that you're working with. And so the way we do that, and what that process is called, is whether or not we're implementing with fidelity or are we adapting. And it is a true balancing act. As we know, fidelity means adherence to implementation protocol. And so as we go to the process, it basically means, are we keeping it the same? And there's a couple of definitions on the board, but here's what I look at. When my kids get sick and the doctor gives me a prescription, I follow it to the T. I make sure if they tell me that it needs to be twice a day, it needs to be made or given with food, and it needs to be 1 pill, not 2, I make sure all of that is done. That is implementation with fidelity. And most parents and most family members understand the importance of taking something that is prescribed and following it correctly. Now, the piece to that happens is that over time, we kind of get complacent. We're like, I think I can tweak this or adjust that, and it shouldn't have any change whatsoever. So as we go through the processes, first thing is fidelity, adherence, dosage, quality, participant responsiveness. A lot of people try to start out with fidelity along these pieces, and it's important that we do. And as we go through that process, what happens, though, is over time, we get complacent, or somebody comes in and says, hey, I've been teaching this for so long, I know better. and I'm going to change up this practice with this, and I'm going to take out this exercise and do that. And before you know it, what happens over time is we're doing adaptation. And one of the things that's important to note about adaptation is Backer in 2002 pointed it out, and that it can be either a deliberate or an accidental change. So as you go through this process, adaptation is any departure from the fidelity. I didn't give my medication twice a day, I only got it once. I didn't give it with food. Is that why they're nauseous? These are the kind of things with adaptation that we start having to look at. Some cases, adaptation is unavoidable. You're doing something, a fire alarm goes off. Unintentional, but it's still something you need to track and see what the impact is over time. So a lot of people make adaptations just based on the environment they're in. Others will make adaptations based on what we just talked about, and that is they think they know better, and that they would believe that because they've taught it for a while, here's how we can adopt this and adapt it. So as you go through that process, adaptation then is identify what needs adapting, have others view your idea. So as you go through this process, if you're going to adapt, identify what needs adapting, have others view your idea, seek approval from the developer, evaluate the impact, and then send those results back to the developer. And this is important because one of the things that occurs is you will get strong, very capable staff who want to adapt. And they'll want to adapt because of their skill sets and what they know is happening within the group that they're dealing with. But people also tend to adapt some cases because they want to overcome their weaknesses. There was one curriculum that required role play, and a staff member of mine really didn't want to do role play because it took them out of the teacher role and made somebody else interactive, and that was uncomfortable for them. And so they cut that section out of the curriculum. So there was no longer any role play going on. It was just them imitating different voices as opposed to the kids' interaction. So one of the things that occurs, and one of the things that I always want to encourage everybody to do, is most curriculum developers still exist. They're either institutions or programs or individuals. Get a hold of the organization that owns the program or evidence-based intervention you're going to implement and ask them about adaptation. Most of them will welcome your feedback. They want to hear from you. They will be able to sit back and say, hey, please let me know. They may also tell you, no, don't do it that way. We've already tried it, and that doesn't work, and here's why. Don't cut out the interactive part because it's essential that kids get a chance to practice refusal skills. And without their practice at it, we do not have kids who are capable of refusing under stress. The other piece about that is in many cases, the developer will want to know what happened when you made that adaptation. And when you make that adaptation, they may actually make that a change in subsequent versions of their materials. So don't be afraid of adaptation, but definitely seek permission first. If it was unintentional, you may want to go to them after the fact and say, hey, this happened and here's the outcome, and we found out it had no effect, just FYI. So as you go through that process, don't be afraid to go to the developer and ask about adaptation and then send them back the results. Almost all developers I know of, and I know quite a few, and it's all because I went out and sought approval from them. When I wanted to make changes, I got that approval. And it could be minor changes, like some of these curriculums were written in the 80s and the 90s where the terminology today is completely different. One of them, the term hookup, meant to supply you with supplies and equipment, and that was the 80s and 90s version, even in the early 2000s. You mention hookup in a high school class today or middle school class today, you get uproarious laughter because it means a completely different set of expectations in that verbiage. So as you go through the process, we were wanting to change terms like that. So go to the developer and say, hey, we want to change this term to that. Is that acceptable? So as we go through it, there's some advantages and disadvantages to the adaptation, just as there are in anything else. So as you go through that process, advantages and disadvantages for replication, i.e. replicating with fidelity, program requirements are clearly defined, implementation guidelines as well. The disadvantages is that it may not be designed for this particular population. It may be too expensive to implement as is, so having some reduction in cost through adaptation might work. Adaptation, the advantages may more accurately meet your needs, but the disadvantages, likelihood of achieving the same outcome as the original program, are diminished. And that is a big concern, and that's why you need to track any of your adaptation. You give your children prescriptions of medication specifically because you know that based on research that it is supposed to fix and resolve the issues that they are experiencing. Conversely, that's why you buy these programs and spend staff, time, energy, and effort to implement them, whatever they are, and changes can have an impact on that outcome. As I close out my portion of this, I want to make sure that we see one clear thing, and that is we have moved a lot, and we have changed a lot as a field. As we talked about last week, we used to believe that selling children was a good way to protect them. We now know, based on research and hard science, that is not true. We used to believe that giving our kids alcohol, cannabis, chloroform, and morphia in the forms of a nighttime cough suppressant had no ill effect. We now know that's not true. We had assumptions before. We have science now. That science comes from you. That science comes from everybody on this call who's working in the field. You have it. You are the professionals. And what happens to our profession is we abdicate a lot of that responsibility to somebody who can write well and publish an article. Don't let that happen. You are the source of information and expertise in your community. Be that. Stand up and do the interventions that the way they're supposed to be, and then report on your outcomes. Remember, great data is great. Bad data is even more important because it tells us what not to do. Don't back down from the data you collect or the outcomes you achieve. They inform us. I've enjoyed being with you. I'm going to turn this back over to Erin to wrap some of this kind of processing up. Again, I apologize for my technical issues earlier, but it is, again, very vital, in my opinion, that each and every one of you in the role that you do, you are the unsung heroes of what is happening positively in your community. Continue to be that person in your group, and as you can and as you will, please publish the results you get. Thank you.
Thank you so much, Kyle, for sharing with us and all your expertise. And Kyle's point is so well taken. We've come so far, and it's because we've used data and we continue to use data to guide us in all of the work that we do. This field has come a very long way. So I want to take a minute, though, while we have Kyle on the phone, he is such a great wealth of resource, to take a second and see if you have any questions. Is there anything that you'd like to know, any issues that you've run into in the way that you've used data to make decisions, in the way that you used data collection processes that you'd like to ask Kyle? And I'm just going to give it just a beat. If you want to just type in the chat, you can. I know that he covered a lot today about data-driven decision-making and how to use that. There's a lot of information to take in. So if you have any questions, now's the time. Otherwise, I just want to thank you from the Great Lakes PTTC for being here today and being a part of this series. It's been my pleasure to be here with you and hear your questions and see your input. You guys have a lot to offer, and hopefully this is useful for you. And I think that wraps up. We're going to stay on the line to take questions as they come up. But that is the end of our presentation for today. Thank you so much. Thanks, everyone.